Hi, I'm Elizabeth Lee, and we're going to talk today a little bit about tummy tuck, one of the most amazing surgeries. There are a couple of different topics we're going to discuss, and these are based on what most patients ask when they come in for consultation. So a tummy tuck is really a repair in multiple layers. Everybody knows that we're taking out stretched out skin and fat. But what a lot of people aren't aware of is that we're also restoring the appropriate anatomic relationship of the muscles of your abdominal wall. So you look better, but you also can move better and exercise better and support your back better after tummy tuck surgery. And when everything feels better and you look better in your clothes and people are not asking you when the baby's due anymore, even though you're not pregnant, then we are helping to help you feel better about everything that you do. Tummy tuck is a big operation, and the patients who are looking for tummy tuck are often younger women, although we do treat older patients too. But younger women will have young babies at home, and they're nervous about recovery, and they're nervous about what they're going to feel like and how well they're going to be able to take care of their children. And so it is important to recognize that 97% of women on Real Self who've had abdominoplasty or tummy tuck surgery are glad that they had it done. But I'm going to be really honest and say that when patients come in and see me the day after tummy tuck surgery, they usually shuffle in and ask me how I could have possibly have let them do this to themselves. And we expect that. And I promise that by the next day or so, you're going to start feeling better day by day. So let's talk about this deeper layer and what happens in the deeper layer. This is a diagram of the abdominal wall, and you see two muscles that are segmented running up and down the center of the abdominal wall. And the yellow area in between the two muscles is called the fascia. And specifically, it's called the linea alba. So when we stretch out, most commonly during pregnancy, to accommodate the growth of the baby, the muscles can stretch, but more significantly, the fascia can stretch in between these muscles. And after delivery, the muscles can shorten up again because muscles contract. That's what they're designed to do. But that connective tissue has no elastic recoil. So what that means is that if the fascia has stretched out, you will have permanent separation of your two rectus muscles with space in between. And that's what's referred to as rectus diastasis or diastasis recti. And the symptoms of this are that you have a rounded, looser belly wall. You can often still feel like you look pregnant. And because that fascia is stretched out and the muscles are no longer anchored in the middle and touching each other, the entire core of your abdominal wall and back will be out of balance. And no amount of exercising or physical training will anchor those muscles back into the middle. And you will have anatomic distortion unless this is fixed. So let's look at this a little bit differently from a different view. Inside the lavender circle are the rectus abdominis muscles, and what you're looking at is a whole cross section of the abdominal wall. And it's important to note that the other abdominal wall muscles, which are the internal external obliques and the transversus abdominis muscles, wrap around from the back and in the outside border of the rectus muscle. So you can imagine, although this picture is not showing rectus diastasis, that when there is separation of those rectus muscles, not only are the rectus muscles in the wrong position to work well at what they were designed to do, but none of the other core muscles are being held out to the proper length of stretch. And length of stretch is where the muscle is at its strongest. So your entire core is out of balance when you have rectus diastasis. And because your core doesn't work well, it's difficult to support your back, and you can develop back pain over time, in addition to just not liking the way your stretched out belly looks. So patients often ask, well, do I have that? And you might be wondering that at home now. And the best way to determine that is with a evaluation in the office and a physical examination. But you can lie on your back, put your fingers just above your belly button, right in the midline, and then raise your head and shoulders up off the floor like you're doing a crunch. And if you can put your fingers in between those two rectus muscles that can, as they contract, you likely have diastasis recti. If you've been doing your research, you've probably noticed that there are many different operations described, all of which can help the appearance of your belly, and it can be a little bit confusing to know which one might be the correct one for you. And again, the best way to know is to come in and have an evaluation and discuss everything in person. But I like to describe a little bit about the different kinds of procedures. Liposuction is removing fat underneath the skin. It's done through small operations, and removing fat can change your abdominal contour, but it's important to recognize that it doesn't do anything to tighten up or remove stretched out skin. A tummy tuck or abdominoplasty is a repair in 2 layers where we take out the stretched out extra skin, and we also tighten up that rectus diastasis, so we're reestablishing integrity of the muscle layer of your abdominal wall. We also get to improve the appearance of many a stretched out belly button. Mini tummy tuck is done through a smaller incision, and less work is done, less skin is removed. We don't do anything to the belly button, and any muscle tightening would be done only below the belly button, between the belly button and your pubic bone. Nothing's done above the belly button. And sometimes when patients have a stretched out abdominal wall with a thicker fatty layer, we do a combination operation where we do liposuction of the abdominal wall at the same time that we do the tummy tuck. So when we look at how incisions are designed, the procedure on the left shows a smaller incision and less skin taken out, no improvement of the belly button for a mini abdominoplasty. When we do the full or classic abdominoplasty, the incision is longer, but we get to contour the full abdominal wall from your ribs all the way down to your pelvic bone. And we also tighten the muscle the entire length of the abdominal wall, and we reshape the belly button. A picture tells 1,000 words, so let's look at some of our photographs. These are my patients. This is a very active soccer coach mom who had 2 pregnancies. Her children were teenagers, and she had what we call a high lateral tension abdominoplasty with liposuction of her thicker abdominal wall. And you can just see her incision just above her little bikini. And this photograph was at about 6 months after the surgery. Scars continue to mature, improve, and fade for up to a year after the operation. Here's another patient, a little bit younger, stretched out after her 3 pregnancies, and she had a standard abdominoplasty. You can see the incision, particularly on the bottom right, as this is at about 4 months after the surgery, and that scar faded considerably from what you see here. Here's another patient, 3 pregnancies, stretched out. You can see her rectus diastasis because you can see the bulge of the outside border of the rectus too far out to the side. When you look at the picture on the right, upper. And here she is showing off her teeny tiny bikini after her tummy tuck. Full abdominoplasty. And you can see with her too that she has some stretch marks left behind, because her stretch marks went almost up to her ribs. Her babies were really big and she was tiny. But we have moved those stretch marks further down on the lower abdomen. But sometimes if the stretch marks go all the way up to your ribs, it's not possible to get them all out and close the belly. And here's another patient who went full term with twins and had, I think, close to 18 pounds of baby in there. And she was so stretched out. And here she is after a full tummy tuck. And you can see all the hard work she's been putting in, exercising the muscles, now that we were able to create an abdominal wall that had good and normal core strength. Planning for your surgery is very important. Your overall outcome is so improved by having made the appropriate plans for time off and for help as you're healing. So we do these operations as an outpatient, which means that you come into one of our fully accredited facilities and you have your procedure and go home that same day. You will need a grown-up to take you home. And you should plan to have an adult around to help you get in and out of bed for the first couple of days. You'll come and see me the day after surgery. We change all the dressings, make sure everything looks the way it should. And then you should plan for at least 2 weeks off of a desk type job. During these 2 weeks, I want you to sleep. If you let yourself and you don't do any kind of activity like be on the internet or answer your emails or try to work from home, you will find that your body is needing 16 or so hours of sleep a night. And not all at once. You're not going to sleep from 4 in the afternoon till 8 in the morning. But you will find that you get up, eat a little breakfast, and take a 2-hour nap. And I want you to do that because your body heals during sleep. And if you make sure that you get enough sleep, your entire recovery will be easier. So make sure you have help with your kids. But do not plan to be doing anything around the house for those first 2 weeks except taking care of yourself. Patients can usually return to a desk type job at the beginning of the 3rd week after the surgery. And they'll be fine at work and they'll be exhausted when they get home, because for 6 weeks after the surgery, your body is doing the majority of its healing, and you heal and restore during sleep, and so your sleep requirement will be up from what you're used to. But patients are really consistent that the first day of week 7, they start to feel back to themselves in terms of their stamina and energy. But you do need to plan to have this surgery at a time where you can get a little bit extra rest and where you don't have deadlines hanging over your head. Plan well, you'll do better. Patients often come into the office with similar questions, and of course you'll have some of your own, but I like to address some of the more common ones here. Women are always concerned about how gaining weight may affect their tummy tuck results. And obviously it's a big operation and you want to have it be the launch or the continuation of taking good care of yourself. So a little bit of weight gain or loss here and there is not going to affect your overall result. But gaining a significant amount of weight can make your belly fuller again, usually not in the same way as pregnancy does. But as a general health rule, you want to keep your weight at a good range. Women also are trying to figure out how to plan their tummy tucks. And sometimes women say, I want it as soon as that baby is delivered, and there may be indications to do that. But for the most part, I like patients to remember that their bodies didn't grow to a 9-month pregnancy size overnight. And so you have to give yourself a little bit of time to recover. I also counsel women who are still nursing that having a surgery of this size might change their milk supply. And so while it's not an absolute requirement that your child be weaned, it is something to think about as you're planning timing. Women also always ask when they can resume having sex after tummy tuck. And what I always say is when it feels like it's the right time. This is very individual. And as I care for you post-operatively, we'll discuss this further as it pertains to what you need. I hope you found this interesting. Of course, for more information and specific analysis of your situation, come in for a consultation. I look forward to meeting you.